Hello, Kingdom Warriors. Welcome back to the Growth Lab, where we are growing our mind, our muscles, and we are growing in life. Okay, if you are new to the channel, welcome. If you're not new, what's up? Okay, so today I want to talk about having confidence. Okay, so today I want to talk about having confidence on your precepted residency shifts. Okay, because this is something that I believe that we as new grads should really embody, um, and take that with a grain of salt too, because I think that it is important to have confidence in yourself and your nursing skills when you go on the unit, because now, like, it is very different from being in nursing school and not having as much responsibility as a nursing student versus as a nurse. It's very different, and you have to kind of carry yourself in a different way. And what I mean by that is that know that you are there because you worked hard. For one, you worked hard for that degree in this, and to get through the schooling, and two, because you know some stuff. You may not know everything there is to nursing, because there's so much crap. Like, if you do, like, I'm trying to be on your team, because like, you're very knowledgeable, but it's not realistic. But having, like, self-confidence in a humble way, to know that, hey, like, you know what, God has gotten me to this point, so there's a reason why I'm here. So I know that I'm going to, take in everything, like, that my preceptors telling me, take in their knowledge, and if you have multiple preceptors, take in their knowledge that they're, freely giving to you, which is a blessing because you're learning. And when the time comes to, do a skill that you have gone over with them before, and now it's time to do it on your own, you have to kind of, like, tell yourself, like, I can do this. I can do this. Lord is working within me to allow me to do this, because this patient right here has no idea, that this is, like, you've done this skill a couple times and now you're gonna do it on them, but you have to give them that, like, reassurance that, like, you can do it, like, and even if you can't do that skill, like, you're not able to get it or whatever, if it's like a Foley catheter, or if it's like whatever, you have a team behind you to call on to help you, and somebody within the team is going to be like a fully care queen or king, so they're going to just get it real quick. But with time, and I've heard this from a lot of different people and a lot of different preceptors, is that with time things start to click, things start to come together. But it's just building that confidence, building that self-confidence, to know that you are there for a reason. God has placed you there. And, it may be difficult at first. You got to learn, because in anything in life, we have to go through the hard stuff to really become an expert. It's the growing pains. We got to go through those growing pains to really, like, come out and shine bright like a diamond, baby. Diamond got to go through a lot of pressure, to become that. So that's what we're going through. And take one day at a time. Take one day at a time, and take one shift at a time, because if you try to take on everything all at once, it's very overwhelming, and you can easily get discouraged because you don't see the results as quick, But if you take one day at a time, pray about it, learn from your mistakes, write things down that you may not understand, look it up. Um, Use all your resources that you can, it builds your confidence too. It builds your self-confidence, and then you start to like feel better about doing things or conversating with doctors or whoever, team members, whoever, patients. But yeah, the main thing, if you are a resident or if you are a nursing student, or if you are just a person that is just watching this video because you just want to watch the video, we need to build, you need to build that confidence, because there's people that are going to be relying on you. They're going to be relying on your expertise and your knowledge and your skills to, help them in their most vulnerable time, and possibly in a critical situation. So you got this, Kingdom Warrior. You got this, and keep pushing. And I hope this encouraged somebody today. All right, so thank you for watching if you watched up to this point, and I'll see you in the next video.